AEC. This last couple of years have been particularly difficult with the COVID pandemic. Have you ever really thought about this, that while churches were closed or restricted in having access and limited numbers of people were allowed to come to church, millions of people went to hospitals. We had over 2 million cases of COVID and over 80,000 deaths from COVID. But people were allowed to go to hospitals. The hospitals never closed. Have you realized that your healthcare workers in the hospital, the cleaners, the security guards, the administrators, the pharmacists, the physiotherapists, the occupational therapists, the psychologists, the social workers, the doctors, the nurses, the maintenance men were all at work and were all meeting with people every day. Meeting with people in their need, meeting with people who were sick, meeting with people who were suffering, meeting with people who were distressed. When we go to work, we meet people and we find them at a point of need. As healthcare workers, it gives us an opportunity to share with them. Pastors of churches, are you giving support to your healthcare workers from your church to be able to go into their work as ministry to the patient? Are they equipped to give not only practical care, but spiritual insights and spiritual care to the people that come past them each day? More people come into the hospital every week than come into the church. And that's across the world. And so healthcare is a tremendous opportunity to reach out. Are we using this opportunity as a church? Are we praying for our healthcare workers? Are we praying for the needs that they have at work? Are we praying for the specific contacts that they make and they're able to reach many people that we cannot reach? There are healthcare Christian fellowships in many of our hospitals in South Africa. And during the COVID pandemic, they reported that many situations they were not able to meet where they used to meet inside certain rooms which were taken over for other activities in the hospitals and clinics. However, this didn't stop some of them, and they moved outside and met in the car park and drew in even greater numbers of Christians into the fellowship. Others report having gone to the wards to share with patients who were devoid of visitors, finding a remarkable sensitivity to the gospel and many people professing conversion during these months. Great opportunities have been had, and the hospital have been able to distribute literature to these patients. Daily bread have been provided, which is a daily devotional reading, and some Bibles. Are you providing appropriate literature to your healthcare workers to give to patients who come to the hospitals, people they meet each day, whether they're at the security gate, whether they're the clerk filling in the administration who can give them an appropriate verse for the day, or the person serving the food, or the doctor discussing the crises that people are facing. Each person has an opportunity to share the love of Christ. Give them your support as a church. Send them forth with encouragement from you to be Christ's ambassadors in a world that is in pain, for God's sake.
Bangakule gaduye abange swanganga ye bange swangani singaba chelanga iti kosi situ mubani Baba